Hey everyone, how you doing? In this video, let's look at porcelain veneers and let's discuss how many veneers do you actually need in order to get a fantastic looking smile. Now, obviously this number is going to be different for everyone, but we're going to look at kind of broad reasons why you should have more or less to achieve the end goal. And number one thing here is let's define this end goal. What is a perfect smile for you? Okay, we sit down with our patients for quite a long time and we go through the options, go through smile cosmetics and things like that in order to figure out what the least number of veneers we need to do is in order to achieve the results that our patients are looking for. Okay, this is a long process. It takes about 2 hours, but it's critical in defining what the end goal is. Now, doing more veneers does have an advantage. Okay, and I know in a lot of my videos I'm always talking about doing the least number of the least amount of treatment. And I'm going to show you how doing more veneers can sometimes mean less treatment. However, there's a big downside: is the cost. Okay, so veneers in the UK, especially if you go to an experienced dentist, they are going to be expensive. For example, we charge about £1,200 per tooth. If you start counting your teeth, you can see how quickly this number adds up. Now, when we do veneers, we have to take into account the biological cost, okay? And I've mentioned this in other videos. It's really the irreversible stuff we're going to do in order to get veneers for a patient. We want to do as little drilling as possible to the teeth, okay? So because the main reason for doing veneers is to improve the cosmetic appearance of the teeth. We don't want to do this at the expense of health. Okay, so if you've seen my videos about, that girl who went to Turkey and got all her teeth done, they've all been drilled down to tiny little pegs, and this is going to definitely reduce the long-term health of these teeth. These teeth are much more likely to need root canal treatments. They're likely to break because they're so broken down. This could mean that they need extractions and implants. It's basically committing yourself to a massive amount of dentistry in the long term for the upkeep. Okay, so that's if all your teeth are drilled down to stumps. Now, when we do veneers, we try to do it as minimal preparation as possible, and this is why sometimes it's better to do more veneers. Now, let's look at a fairly small case, right? This gentleman came to me quite recently because I'd actually helped his daughter out, and they liked the look of it. So he had a couple of issues at the back. We just sorted those out. It was just basic fillings and just getting the mouth nice and healthy. Because remember, that's number one thing, is to get the mouth nice and healthy. Then we can look at the cosmetics. And this guy didn't like two of his front teeth. Okay, and it was these two. The crown at the front we can see. It's got this black line around the edge because it's an old type crown with a metal core inside it, and it was more forward than the other one, so it's catching more light. It wasn't the right color, and the tooth next to it was a natural tooth, but it was smaller. Now, we had the option of just doing two veneers on this. Okay, so one is the crown, which I call a veneer just for simplicity, but the other one would be a veneer as well. Now, to help our decision, you need to look at the teeth from the kind of like a bird's eye view, and this is what it looks like. And in order to create a nice smooth smile so that when he rubs his tongue over the front of the teeth, they all feel smooth, if we just change the old crown and we put a veneer on the tooth next door, we have to match the end position of the crown with his natural tooth on the other side. Okay, and that's the only way we're going to create that flush look. If one tooth is forward, it's going to catch more light. It's always going to look a different color. So it's important to get the teeth nice and straight with each other. Then what that means is once I've taken the crown off, we need to give the tooth a bit of space. We need to give the veneer a bit of space. They typically need 1 millimeter. Now, labs will tell you otherwise. Labs will say they can make it 0.3 millimeters. This is true, but you get a lot of show through of the underlying tooth with that thin a veneer. So veneers need a little bit of thickness to kind of cover up what's underneath them. Then, once you've taken the old crown off here and we've done our tooth adjustment, we're getting really close to the nerve, and we could be condemning this tooth to needing root canal treatment. Okay, so what's our other option? We could actually bring everything else out and forward, okay? And what that means is The crown which is forward, we use that as our kind of guideline. Okay, and this line that I'm drawing here, this is called our arch form. Okay, so what we're doing is we're expanding the arch form, and we can only do this if we have more than 2 veneers. So here we chose to have 4 veneers, and 3 of them were almost non-prep. Okay, and that means we hardly did any kind of drilling of the surface. All we did, the sharp edges, we just smoothed those off. And we do this under like 5 times magnification, so we're really precise with the amount of drilling and keeping everything minimal. As always, we built everything up in our temporary materials first, and then once the patient was happy with what it looks like in the temporaries, we got it made in our porcelain. Now, the reason I know this is very minimal prep is that the temporaries broke. And the temporaries broke, he had 0 sensation, like no, he didn't get any sensitivity or anything like that underneath. That means that the enamel surface of the tooth is all intact everywhere. Okay, so this is one example where we had the option of doing 2 veneers, but we chose to do 4 because it actually involves less tooth adjustment. Okay, it increases cost, but long term is the better thing to do. Now, let's say we're in a more complicated situation where we need to look at more teeth, or you just want to have a really amazing smile, a Hollywood smile. Then, if we have the opportunity to do, say, 10 teeth, okay, so premolar to premolar, what we can often do is bring this arch form out by 1 millimeter all the way around, and if you have teeth which are crooked, they may still need a bit of adjustment to fit within this arch form, but the further out you can bring this arch form, the less tooth adjustment we're going to need to do. So sometimes I get inquiries on Instagram, Facebook, or whatever, and they say, hey, look, I've been to someone, and some people have said braces, some people have said veneers. What's the right thing to do? Okay, the truth is it depends on your individual situation, what you want, how much you want to spend on this, and what your end goals are, what the teeth actually look like. Because once you've had braces, most people are actually pretty happy, okay, unless the teeth themselves are totally wrong color or shape or whatever. Now, this is all great in theory, but what does it mean for you if you're thinking to have veneers? What should you do? And in these situations, what we tend to do is do a trial smile. Okay, so what this means is a smile which is made to look like our final result, all just made from temporary materials. So we do that for our patients with maybe 10 teeth. Say we're deciding whether we need to have 10, 8 or 6 veneers. So we'll do it with 10, and the patient can go home, get the feedback from friends and family on what it looks like with 10. Then we can just take the temporaries off, it's usually the back ones, which are the option ones, so we take those off and see what the trial smile looks like with 8 or 6 veneers. It doesn't need to be a symmetrical number, it just typically is. That way we know that if my patient is happy with 6 veneers, okay, and he's tried 8 and 10, then there's no guesswork involved. I know that those 6 veneers is going to give the exact benefit that the patient is looking for. And really, that is the goal. Okay, the goal isn't to have 10 veneers and 10 at the bottom as well. I'll come on to bottom veneers in a second. The goal is to have an amazing, confident smile that every time you look in the mirror, you really like what you see. When you're out with friends and family, and you're at a restaurant when we're finally allowed to go back to restaurants, you can laugh freely, anyone can take a photo, and it's going to look great. Okay, that's the goal. Now, a lot of people, I'd say about 60% of the people who we do veneers for will only get the top teeth done. Okay, and that is partly due to cost, but also your top teeth are about 80% of the smile. Now, when I tell people this, people think that it's always going to look odd when you have your top teeth done and you don't have your bottom teeth done. And it is true, there is going to be a mismatch in colour. But typically you can always have the bottom teeth done at a later date. It's better to do it all at once, but you can have it done at a later date if you want to. Remember, bottom teeth are smaller, so if we do a little bit of adjustment on a bottom tooth, it is more of in percentage terms, it's more adjustment on the bottom teeth compared to the top teeth. And typically you don't see all of your bottom teeth, so you only see the top couple of millimeters. So often what we'll do is we'll just level out and focus on creating the appearance that the bottom teeth are nice and straight with something like composite bonding or just polishing the teeth. Okay, and this has a massive effect on the overall look of the smile. The color difference doesn't matter as much as you think, because the bottom teeth are always in shadow, so they're always going to, even if you have exactly the same color porcelain top and bottom, the bottom teeth will look slightly different because they're more in shadow compared to the top ones. Okay, I hope you found this video useful and informative. If you have any questions, please drop them below. I do read most of them. Okay, these days we're getting a few more comments and my phone's always going off. I do try and respond to the ones who've got really clear questions. But until next time, guys, take care.